My name is Mark White with University Hospitals. I welcome you to today's health talk regarding the management of chronic cough, throat clearing, and all that mucus. Couple housekeeping topics before we get started. We welcome you to these virtual talk series, as we've typically done health talks out in the community, but now in the day and age of the COVID pandemic, we're trying to make sure you still get the health information you need by these virtual health talks coming to you in your homes and offices. The opportunity for you to ask questions will be at the end of the presentation. If you notice at the bottom of your screen, there is a Q&A button. This is where you'll submit your questions for our presenters. A lot of your questions may be answered during the talk, but if they're not, feel free to submit them through the Q&A section. I will read them for the panelists to answer for you. There is also a button when you click into the Q&A button that allows you to submit them anonymously if you so choose. Also let you know that this talk is being recorded. Will be sent out in an email to all registered attendees about a week or so after this talk. You will get a link that you can go back and watch this on our website and also share it with friends and family. And there will also be the contact information for the physicians in that link as well, in case you miss it today. With that, I'll like to introduce our panelists. First, Dr. Scott Howard is the Director of Voice, Airway, and the Swallowing Center. He is board certified in head and neck surgery. He is fellowship trained in laryngology, and he did his internship and residency at Walter Reed Military Medical Center, and is also a graduate of the U.S. Military Academy at West Point. Also presenting today is Lex Rakowski. He is a classically trained singer and speech-language pathologist who works alongside Dr. Howard in the Voice, Swallow, and Airway Center. He received a Master's of Communication Sciences and Disorders at Chapman University and completed her clinical fellowship at South Shore Hospital in Boston, Massachusetts. In addition to her studies within the field of speech pathology, she has completed training in the Transformational Voice Training Institute in Portland, Oregon, where she specialized in training the artistic singing voice. Lex specializes in treating voice and swallowing disorders for both speakers and professional voice users. Outside of UH, Lex enjoys singing, teaching singing voice and singing lead vocal with her rock band Mabel and the Wolves. Without further ado, please welcome Dr. Howard and Lex Rakowski.
Thank you very much. It's great to be talking to you today about a topic that Lex and I see quite a bit. We are seeing clinic at a number of sites, and we've been seeing a lot of patients with cough, throat clearing, and a lot of mucus. As the seasons change, we see a lot of different changes in that. Mucus is a funny topic. My kids at least would say so. And we're going to go through a number of conversations about it. We both have no disclosures to discuss. And like he mentioned, I am the director of the Voice, Airway, and Swallowing Center. Lex and I share office time together. We see patients together at the Seidman Cancer Center at the main campus, Chagrin-Minoff Center, and I do surgery at the main hospital as well as at Richmond Heights. And Lex, in addition, sees patients at Westlake and at Bulwell at the main campus. So we'll give you some information at the end as well about appointments if you ever would like to get in touch with us. And we have a very nice collaborative and multidisciplinary practice. One of the great things about being a laryngologist is the opportunity to really work side by side with speech pathologists. And I get to perform a lot of procedures daily, such as laryngoscopy, where we look at the voice. We'll actually see a video in a short while about that. And I perform surgery about 2 days a week. But our multidisciplinary model allows us to see a collaborative environment. And obviously in today's day and age, we typically look more like this when we see you, although we also do a lot of virtual visits as well. And we can see you like this on the screen. So it's a very interesting practice, and we deal with patients with a lot of problems dealing with the voice, airway, and swallowing. Chronic cough is a very common problem. So today's talk, we're going to talk about what a cough is, some of the causes of chronic cough, some of the concerning features that would warrant a referral, to one of our mucus managers, and we'll discuss who those people are, discuss some mucus facts and fiction, something about the unified airway, which may be new and a new topic for many of you, and then discuss a lot of common things that may help you with your mucus. First off, I'd like to say that the cough is very important, and it's a very useful part of our defense against disease. A thin mucus layer within the lungs and the back of the nose actually protects the body, and it helps us expel bothersome substances from the respiratory system. Mucus and the cough also help prevent aspiration, where something would go into the airway when you're swallowing. There's a lot of areas that can trigger the cough. As you look at the screen here, you can see a lot of these areas. So the cough center in the brain, and then there's a lot of different areas that are stimulated by the nervous system to actually trigger a cough. An interesting one as an ear, nose, and throat doctor is when we look and clean out an ear, let's say. As we look in the ear and touch a certain area of the ear, there's a nerve in there that immediately triggers the cough reflex. So many patients will cough while we're actually cleaning an ear. A lot of these nerves are very similar. If you trigger it in any way with a chemical or a mechanical stimulus, you will trigger a cough that is uncontrollable. We also have a control over our cough reflex to some extent. Now, when we think about the cough, there's here we have a cough receptor kind of in the mucosal layer. There's a number of areas where these cough receptors can be influenced. Histamines, and you think of antihistamines or something you might take when you have allergies, are an area that we can address with medications. There's also prostaglandins, another area for allergy. And a lot of the medications we use to try to stop cough are targeting some of these areas. Some of these up here are some of the newer forms of cough suppressant medications. We do have volitional control over some of our cough and can prevent it, but oftentimes that sense that you need to cough is very bothersome to people, and sometimes that cough almost itches a scratch that you might have. But that's unfortunately something that we oftentimes counsel our patients against, because that cough can actually cause injury as well. So what is mucus? Mucus is something, again, my kids find to be quite funny, but mucus is a very normal product. And in fact, we make about 1 to 1.5 liters of mucus a day. So let me just remind you, 1.5 liters is just a little bit less than a 2-liter bottle of soda. So imagine that much mucus in a single day being made. Why do we not feel this mucus even more on a normal basis? Well, it's because it's normal. And when it's thin and normal in consistency, we typically don't feel it. Healthy mucus is about 90% water, and the remaining 10% includes salts, sugars, proteins, lipids, minerals, immune cells that are also part of the immune system, and mucins. And these mucins are very important. They are produced by goblet cells that are inside of our mucosa, which is the lining of our entire aerodigestive tract. So it lines our nose, our mouth, our throat, our trachea, our lungs, down into our GI system, our esophagus and gut. And these mucins are what give mucus a lot of its specialized properties. It gives it that slippery feel, and it creates a strong barrier to microbes and irritants. Now, the mucus also helps keep the epithelium lubricated, moist, and it moistens the air as we breathe. If we look at the mucous membrane for the entire body, it covers about 400 square meters of surface. That's about a basketball court. So you can imagine all of this area is creating mucus, and it is protecting ourselves from infection. So we already mentioned a little bit about the mucus blanket. It's a thin layer that covers everything. And this is important, but it also helps moisten the air. And there's these little things called cilia that sit in certain types of specialized cells within the aerodigestive tract that help move this blanket of mucus to remove things that may go into the lungs. Now, one of the things that's tricky is if you're a smoker, that cilia is typically paralyzed by the actual act of smoking. So that tobacco paralyzes that cilia, and it also causes something else. So when we think about these mucus producing glands, smoking actually causes those to be hypertrophied or expanded, and they create more and thicker, stickier mucus. So smoking is typically quite problematic because it causes hypertrophy of these glands. Now, a cough is also a very important thing, like we mentioned. The way that a cough works is listed here. I'm going to have Lex talk briefly about how we cough.
All right, hi everybody. I thought it'd be a good opportunity now to cover, well, what is the mechanics of a cough? What does a cough look like inside of our body? So again, the goal of a healthy cough is to clear mucus or food particles or things we don't want in our airway out to keep our lungs nice and clear so we can breathe. When a cough occurs, it happens with our two vocal folds. So our vocal folds sit on top of our airway and they sit in a V. And when we're breathing, our vocal folds are open. When we go to speak or sing karaoke, we bring them together and they vibrate based off of the air that we send through the vocal folds themselves. So when it comes time to create a cough, we take a deep breath in, the vocal folds are open wide to get all that power that it's going to use for the cough. Then we bring the vocal folds together, send a very forceful flow of air with the muscles of our abdomen, our chest, the pressure of the air in our lungs, and the vocal folds close, expel out, flicking whatever mucus or gunk or whatever we need to get out of our voice into our throat, out of our mouth, or down into a swallow. A cough itself can be incredibly forceful. The airflow generated within a cough can go up to 50 miles an hour. So it can be a very fast, forceful process to clear whatever we need out of our throat.
Yeah, and these coughs can be both a conscious or a voluntary maneuver, but oftentimes are uncontrollable or involuntary. The involuntary ones are typically, like we mentioned, those that are stimulated by a cough receptor, but the conscious ones, and sometimes we do have some control over this, are a little tricky because most patients will say that they can't control it. They have to cough because of the stimulus that is being irritating them. Now, just a quick public service announcement. So 50 miles an hour is a pretty fast stream of air, and we don't want to be sending stuff all over, especially now. So make sure you cover your cough. The best way to do it is not to put your hand up there because, again, you're going to get stuff on your hand and then you're going to touch something. The best thing is to, well, my kids will call it cough pocket. So kind of put your elbow up and cough and or sneeze into your elbow. That's a much safer way to do that. Now, cough, like we said so far, is a very important thing, and it's an important part of our immune system and being able to protect ourselves. But it is also problematic for many patients. It actually causes up to 3% of all physician visits across the board. Now, a minority of these are serious issues, but they can be, and we're going to talk in a minute about some of the things that if these are happening for you, you definitely need to be seen quickly and kind of address those. But it's also a very, problematic issue because people cough a lot and they have a lot of, social issues with it. I'm not going to go into all the different things, but patients will have anxiety, sleep issues, incontinence even from cough. There's even people who get rib fractures from coughing so hard. Lex and I see a lot of patients with voice changes. And right now, if someone's coughing a lot, with COVID going on, it's definitely a thing that socially is very challenging because even if you're wearing a mask and you're coughing, people are going to be looking at you kind of funny, wondering what's going on. There's a lot of products on the market that are used to try to suppress cough. Some of them are good, but many of them are not. And we'll talk about ones that are good and ones that aren't today. Now, warning signs. So things, obviously, if you're coughing and you're having shortness of breath, you're having noisy breathing, that would be a problem. Obviously, turning blue, definitely not an easy thing. And of course, if you're talking about children, if they're not drinking or eating and just feel, very ill, those are patients that need to go in and be seen by the doctor. Fevers are another thing entirely. You know, oftentimes colds can be caused by a cold, or some of these coughs can be caused by a cold, the flu. So you want to get checked out and make sure you're doing all the right things. Now, chest pain can be caused by the cough, but there can be other things that cause chest pain, to include heart conditions, that can actually trigger a cough as well. So if you're having, you know, heart-related issues, or if you have a history of that, that would be something you want to get checked out. And lastly, blood, or kind of a brownish tinge to the cough. You probably want to be seen and get a chest x-ray and make sure there's nothing else. Now, one of the things that I think is important to talk about is a concept called the unified airway. And the reason I bring this up is it's actually something that was introduced back in the 1920s, but hasn't really been studied that much until the last 30 years or so. And what it basically says is that the airway in its entirety is connected. And a lot of the diseases that exist around and in that airway, or within the esophagus, so when you start talking about the sinuses, the lungs and the nose, asthma here, the ears, voice, and the cough, these are all related in that they're all combined into this unified airway. We don't always follow our own guidelines on this, and we don't always think about what is going on in these other areas, but we should. And that's one of the things that's great about my job, because I am right at the crossroads of the airway. This is a larynx, and this one is not a very happy one at all. You can see a lot of mucus and things sitting in this space. But it sits between the mouth, the nose, the esophagus, and the trachea. And because I look at this every day, I can look at the health of the nose and the mouth, the esophagus, and the trachea by doing a laryngoscopy. And what a laryngoscopy is we take a small flexible scope, we numb up the nose a little bit, and this small spaghetti-like scope goes in through the nose, and we can see the vocal cords and the voice. And this is a normal stroboscopy. We can actually see the vocal cords vibrating here. And this mucosa is very healthy. And you're going to see some mucus here. This is very healthy mucus, very thin. It glides along the surface as the voice. And as the patient breathes, we can see down into the trachea. Now, when I see a patient, I'm looking at a lot of things. So I'm trying to get a lot from their history, trying to understand what their past medical conditions are, what types of surgeries they may have had, trying to understand a lot about their recent history, whether they've had symptoms of a cold or something else. I look at their medications to see if they're on ACE inhibitors that might cause a cough, sometimes even a long time after they've started it. We look for other types of conditions like smoking, for example, that might be leading to their cough. Now, depending on what we see that there's a lot of chronic cough involves 3 different types of problems. And I'm going to go through these, and we're going to then kind of lump them together a little bit and kind of understand a little bit of what's causing these coughs and understand what we can do about it to help you as our patients manage some of the things that are simple. And then, of course, if there's issues that are not addressed, make sure you get in and see what I'm going to call our mucus managers to help you. So the big 3 causes of cough include something called the upper airway cough syndrome. That's a fancy bunch of words that we kind of abbreviate here, but it includes something we used to call irritable larynx or cough hypersensitivity, and some people just call it postnasal drip. And what it basically means is that there's a lot of inflammation and irritation that seems to be triggering these cough reflexes. This is a little bit challenging to diagnose, but within my practice, we get to see it all the time. Oftentimes you'll see cobblestoning, or these little lumpy areas in the back of the throat, which may represent some allergy or some reflux. It may represent other types of irritants, whether it be smoking or using inhalers that can actually cause inflammation. You can get fungal laryngitis, other types of conditions that can lead to these symptoms of a chronic cough. Typically, we will have some sort of a therapy that may be medication related, But we're going to talk about a lot of the things that we do that are not medicated related today, because almost all of them are very helpful. Now, the postnasal drip sensation is a very common one that we see in patients who have cough. They feel the mucus. And like we said earlier, mucus is very normal. We make a lot of it. When you're feeling it, it typically means something is going on with your mucus, and that we need to work on that together as a team. This upper airway cough syndrome can also coexist with other problems. So if someone has COPD or asthma, they may also have this type of a problem where they have hypersensitivity of these reflexes that are triggering these coughs. Speaking of asthma, cough variant asthma is a very classically dry and non-productive cough. This is less common than the other one we just mentioned, but has oftentimes some asthma-like symptoms. They may get short of breath or some wheezing involved. They get triggers, oftentimes with exercise or cold air. They may have allergies as well, and those allergies may stimulate these coughs. They may be more likely to be responsive to things like beta blockers and aspirin and get cough with those medications. Oftentimes, our pulmonologists are very helpful in treating these or studying these patients with a methacholine challenge, and they can see that they have response to medications that they inhale. Inhaled steroids are very, very commonly used here. The third of the big three is actually something called GERD and LPR. Now, GERD is one we've mostly heard, and that's gastroesophageal reflux disease. But LPR is less commonly heard amongst most people, and that means laryngopharyngeal reflux. The interesting thing about GERD is that GERD, or the symptoms of heartburn, typically require a fairly sizable amount of reflux to cause that heartburn. LPR, on the other hand, does not, and it requires much smaller quantities of regurgitation in order to cause issues. We may be microaspirating, or very, very small quantities of acid getting into the airway and triggering these coughs. This can be a very small amount that happens only at nighttime when we're sleeping. The other thing that's quite interesting about this is that when we have reflux, it causes more mucus because your body is protecting itself. So it creates a thicker layer of mucus. The mucus causes you to cough. And that cough, because you're using all that abdominal support and pressure to cough, can actually lead to more reflux. So it's a cycle that we need to break. And that's sometimes something that we see very commonly taking a little bit longer than some of the other treatments, sometimes as much as 3 months to fully treat these patients. Now, in the old days, they had lots of different things they tried for cough. This is one that I would not recommend, but it's definitely something that we see, again, a lot of things on the shelves to try to help. But here's my favorite, water. So Lex, why do we use water as a primary means to help our patients with cough?
That is a great question, Dr. Howard. So, I mean, if we harken back to the beginning of this presentation when we talked about, well, one, what is mucus and what is our relationship to mucus? We have a very healthy relationship in general with mucus. Think of it as almost as the oil that helps our engine run very smoothly within our throat. So when the mucus is at a good balance, the mucus is a very helpful force, and a good balance for us is around 90% water. So that Goldilocks zone of beneficial mucus is highly contingent upon how much water you have in your body, and we can provide more water by way of water intake. When we have too little water, we're dehydrated, that mucus can often become very sticky and tacky. When it sticks to the side of your throat, that's when you're going to start having difficulties with feeling it, wanting to clear it, and having trouble clearing it, leading to more of this cough. So one of our first lines of defense is to look at, one, how much water are you taking in during the day, and looking at opportunities to be able to bring in more water to thin out that mucus and make it a lot easier for you to manage.
And a good corollary to that is looking for things that are dehydrating. So obviously looking at medications or other things that you may be intaking, caffeine, alcohol, etc., that could cause some dehydration, and trying to reduce things that might be counterproductive. Now, water drinking water is very important, but there's a lot of other areas that are helpful. And here's a couple more that we typically like to recommend. One of my favorites is actually this one up here. It's the sinus rinse bottle. Now, sinus rinse, and I have no ties to this particular company, but this bottle provides a lot of force, a little bit more than a neti pot would, which is this item here. And it can really irrigate out the sinuses. One of the great things about this product is when you irrigate out the nose, I mean, just imagine you're walking outside and there's lots of pollen. If you had a lot of pollen on your arm and it caused you to be itchy, you would, of course, try to wash it off. We don't always think about the same thing with our mucous membranes because it's our mucous membranes and we have mucus there. But that mucus, when it gets these irritants into them, if you can wash them out, you're going to have much less inflammatory response within the nose and the throat. And that inflammatory response that creates those histamines and the prostaglandins that drip down on your voice box and drip down into your airway, that is what is oftentimes triggering the cough in these patients who have allergic rhinitis or other types of post-nasal drip that they're feeling, is they have this inflammatory response. The other thing it does is it removes the mucus, so you're not going to have too much of it. Now, the sinus rinse bottles, I typically recommend people use distilled water. You fill it up to the line. It has its own salt packets. You shake it up. There's also a number of ways you can make your own salt, but these are fairly inexpensive and over the counter. You can get them anywhere. The dry noses gel here is also nice. It kind of sticks in the nose. It can help keep things moist. And having a moist nose is very helpful because it humidifies the air and helps us in our day-to-day actions. Now, Lex, you know quite a bit about steam inhalers because as a singer, that's probably a great thing that you do for a lot of your professional voice folks.
This is, honestly, one of my favorite tools to ensure good vocal health, but also good, comfortable throat. So I like to use a variety of different humidification systems. So having a personal steam humidifier is absolutely wonderful for if you have very thick mucus to help break it up, or if you have a really important presentation to do or performance. I have a lot of performers that'll use the personal steam humidifier both before performance and after as a way to kind of calm down the throat. As a general lifestyle recommendation, I typically recommend folks to use steam, like a personal humidifier at bedside throughout the evening. So that way you're getting 8 hours ideally of really great humid air. And I use this personally every single night. And the nights that I forget to fill up my humidifier, my body sure lets me know the next day. I feel dry, I feel irritated, and my throat doesn't feel as engaged. One quick tip that I picked up recently is for a portable humidifier, because I have a lot of folks that are traveling and hotels are notorious for having very, very dry air, either via their heating system or also through their AC. So a great way to just increase the humidity in the room itself is take a little rag, little face rag, moisten it in the sink, wring it out so that it's not dripping, and just lightly lay it on top of the air vent or the AC vent. It'll help keep that humidity up, and it's easier to pack aside from your large humidifier that you might use at home. So they're all really great tools to have.
Yeah, and if you're concerned about maybe your office space being really dry, you can actually buy sensors that actually can measure humidity. They're very inexpensive. Now, reflux, we mentioned, is a common thing. Now, reflux or LPR is a common problem. And one of the things that we see with that is, again, a lot of irritation from the throat. We see voice changes. We see cough as a primary symptom for reflux. And a lot of patients don't even know they have reflux. We used to call laryngopharyngeal reflux silent reflux, which is really a bad term because it certainly isn't silent. I mean, you're coughing, you're having globus sensation or a sense that something is stuck in the throat. You may have voice fatigue. These are things that are fairly common in patients with reflux. But a lot of people didn't realize they had reflux because they didn't have the classic heartburn. Now, diet is very helpful when we think about what we can do to counteract reflux. Trying to avoid spicy foods, obviously, trying to avoid tomatoes and other things that actually trigger reflux, trying to avoid extra acid from coming in. But one of my favorite things is a product that can include something called an alginate. Now, an alginate is made from brown seaweed, and what it does is it floats on top of the stomach acid. You can kind of see here, antacids go in and just neutralize acid, but that's not very helpful, because when you neutralize it, it helps temporarily to counteract the reflux. But by neutralizing it, you actually create a drive for additional proton pumps, which are on the inside of the stomach, to make more acid. So usually a couple hours after you take an antacid, you actually make more acid than you had before. So it's not very helpful, and you're just going to keep on popping these antacids. And now an alginate, on the other hand, floats on top of the stomach acid and prevents regurgitation, which is really what we're trying to do with all of our medications. So I tend to like doing this first. And if I need to counteract the acid with proton pump inhibitors or H2 blockers or anything else, then we consider that later. This product right here is a very commonly seen one. Gaviscon or Gaviscon Advanced can be purchased online and also at many stores. And basically what you do is you take it after meals and at bedtime. And we do this very commonly in our patients who have cough, because it very much helps them. Some other things that people will do: elevating the head of the bed. And again, typically logging your symptoms. And if you're not getting better, be seen, because there's definitely some issues that we need to look at and make sure there's nothing else going on. Now, this next one is also one that singers use quite a bit, but it's actually adding some of that lubrication. We talked about how the important mucins in the throat. So having something that actually adds to that kind of lubrication is good. But sometimes people will try other types of cough drops that aren't very helpful. Lex, what are some of the cough drops that you find problematic for patients who have cough?
So one that I find that's very common that our coughers use is they tend to go towards menthol cough drops, and also cough drops with a lot of eucalyptus. So these are in the moment, they can feel very beneficial because it helps numb the throat. You are creating saliva, so it's soothing the throat. But unfortunately, that numbing, it also dries out the throat and also impacts your sensation. So long-term use is not actually recommended. And so for those that have a chronic cough and are responding to having some sort of a lozenge, we like to modify that by doing lozenges that are more aiming towards increased hydration, increased moisture. So we're creating a good environment for the throat.
Yeah, very true. Definitely trying to avoid things that numb the throat. And I think, over time, like you're saying, it maybe even upregulates some of the sensation for this cough. Mm-hmm. Expectorants are another item that people use. Mucinex is a brand that many will use, but there's a lot out there. And what this intends to do is loosen up the mucus so you can cough it up easier. And on paper, it's a pretty good idea because you want to make your mucus come up. But the way in which this works is kind of interesting. In order to have this really work, you have to take in more water, which, like I mentioned earlier, is the number one thing that I would recommend most people who have a cough to do. So if you're taking in more water and you're getting more of that water into your mucus, you're probably going to do better. Unfortunately, this has not been super effective in a lot of our patients. And in fact, I think it's more the water drinking that they're doing that is really helping. Now, there's a lot of strategies that we do to help our patients, and there's been a number of studies that have shown that this is very effective. Lex, can you talk a little about some of the things that we do to help our patients with throat clearing strategies as well as cough strategies?
Yeah, sure thing. So there's a number of things that you can do, what I term out in the wild, when you don't have your nasal spray, your lozenges and things, different strategies that you can put in place for that time that you do feel that the irritation, that tickle that Dr. Howard was talking about before come up, in order to quell the cough, quell the throat clear before it even occurs. I've listed some of my favorites here. The first, and it's, again, this is to relax the throat for when you do feel the tickle, is to try a cough suppression swallow. So what that is it's simply tucking your chin down and doing a hard and long swallow, like Dr. Howard is beautifully demonstrating right now. I also find that if the tickle or the irritation is sitting on one side of your throat or the other, turning your throat towards that direction just increases the compression over that site. So it helps soothe that area in a more effective manner. You can always add a little sip of water if you want to make this a gold star strategy. Other things that you can utilize is a technique called relaxed throat breathing. So again, that tickle is causing a constriction in your throat and irritation. So you can try doing a slow sniff in through your nose to open up your airway and then breathing out through rounded lips. This helps relax and open the throat. What I find a helpful modification on this is if you're right on the precipice about to start that cough, is to actually change the order. So do an in through the nose and an out through a very soft S. So it'd be a sniff in through the nose, out on an S. What you're accomplishing when you do this, again, because you're right about to cough. So those vocal folds that I was talking about earlier in that feed, they're itching. They want to do that cough really bad. So when you do the slow breath in through the nose, you open the vocal folds themselves. And then by doing that S, you're going to just do a slight engagement of the vocal folds with the S. So I liken this to if you have kids that are getting into something that maybe they shouldn't be getting into, you, instead of just taking that thing away, you have to take away the inappropriate thing, like the Sharpies going on the wall, and give them something appropriate, like a dry erase marker and a dry erase board. So by doing that S, you give the vocal folds something to do instead of the phonotraumatic behavior such as a cough. I also really like sour lozenges too, in order to increase moisture, and it also helps soothe the throat too. The last thing that I did want to cover on this slide was what to do when you are already in a coughing episode. We do see several patients that experience these severe episodes of coughing where they get into a cough and it's very hard for them to stop. And this leads to increased throat aggravation, difficulties breathing, lightheadedness, and severe hoarseness. So once you're in that moment, a very helpful strategy to get out of the cough and so then lessen the severity of that coughing episode is to actually do something similar to the relaxed throat breath. So you're going to do the sniff in through the nose, but I find it helpful to do it a little bit more forceful. So and then out through either your S or your rounded lips. Again, when you do that hard sniff through your nose, when you're in the coughing episode, it pops open the vocal folds. So I liken it to you're taking those two fighters that are coughing, and you're putting them to opposite sides of the ring. So it's a really great way to, again, stop that cough and have a successful end to your coughing episode. I think I want to talk about then mucus management on our next slide. Oh, yes. Okay, so the strategies that I just talked about, again, are for before when you have that little tickle, the dry tickle, and then when you're in the coughing episode. What I have up on the screen right now are different things that you can do for when there is mucus that you have to move around from the throat. So my top two for that little bit of mucus that's sitting on the vocal cords themselves is what we call forced expiration, which is basically a hard exhale. There's two different ways that you can do this. One is to do a hard P sound like this, followed by a swallow, or to do a hard exhale, almost like if you're watching a comic, if the main character gets sucked in the gut, he'll do this sound, and then do a swallow. When you do both of those strategies, you're successfully mimicking the movement of a cough, again, flicking the vocal folds up to remove that mucus. But because you don't turn your voice on in either the or the, you're not actually making the vocal folds come into that very aggressive contact point. Afterwards, if you incorporate the swallow, you successfully clear that mucus down into your stomach so you don't have to worry about it anymore. My other favorite for when you feel extra gunky, so this is really great for in the mornings and also for times if you're very sick and producing a lot of mucus, is to clean out your throat with a seltzer gargle. So the seltzer gargle is a way to remove the mucus without a cough. So you use either seltzer water or club soda. What I'm looking for is cold carbonated liquid. I do not recommend doing this with a Dr. Pepper or a Coke, simply because of the extra sugars that are involved. I really want water and fizz. So you take about a half a cup of that, again, ideally cold, sip, gargle, 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 spit, and keep going until that half a cup is gone. It tends to be around the five gargles. What happens when you use that strategy is it's the cold that takes away some of that sticky tackiness of the mucus. It chills the mucus itself. And then the carbonation is really key here. So with that carbonated liquid, it's abrasive enough to break up that mucus. Kind of think that it's your scrubbing bubbles of the throat. And it breaks all that up so you're able to then spit it out and it's out of your hair. So wonderful tool in the morning, but honestly, whenever you need it, you can go to it. You're not going to cause any damage by extra seltzer gargling. So that's my mucus removal strategies, huh?
That's a great number of things to do to kind of get rid of some of that mucus.
Yeah, yeah.
So,
another thing that I find too is also when you go to just mucus removal, cough reduction, is to look at in general just vocal wellness. And Dr. Howard already beautifully touched on a number of these. I think of these as the ways to set your voice and your throat up for good success. So just to review the ones that we went over before, of course you have water intake, making sure that you're getting that water in. And there's a number of different strategies that you can use to ensure that you're starting off with a good amount of water during the day. But I recommend just taking a survey of yourself over the next couple of days, see where you're at, and see how you can increase it from there. We touched on different ways to increase your humidification. So using that tableside humidifier, personal steam humidifier, or even the towel if you're out and about. And Dr. Howard showed you a couple of pictures of different nasal rinses. So ways to really clean out the nose with that squeeze bottle, or also using little sprays to keep the nose moist. Allergy management being a very important key if you do have allergies, to make sure that you're not producing that extra mucus. So talking to your allergist to see if there's ideas on ways to combat that. I also had oral moisture listed. So we talked about the throat lozenges that keep you salivating, keep your throat nice and moist. And of course, our favorite and a very common one for us is reflux management. So using things like Gaviscon, possibly in conjunction with a proton pump inhibitor such as omeprazole or Prilosec, to make sure that your reflux is not coming up and then impacting your throat as well.
Yeah, and obviously, when we think about the cough, we're creating a lot of forces on those vocal cords, and that can cause a lot of trauma, and that trauma can trigger more cough. So it's a tricky thing, but once you start reducing the cough itself, most patients will notice that their coughs are less likely to occur. And it takes a while. It's not something that happens in a day, but these cough reducing strategies are very, very helpful. But together with that, we also like to think about avoiding really voice overuse. So yelling and screaming, loud talking. So sometimes a little bit of voice rest can be helpful. And we even do voice therapy. And sometimes we have conditions that voice therapy will help because we have a voice condition that is actually triggering the cough. So Lex, what do you do for patients who have this condition?
So up at the top here, we have muscle tension. So it's extra tightness, extra muscular constriction in your throat. And sometimes this can lead to something as simple as a cough. Sometimes the picture can be more complex, where it changes your voice, where it leads to vocal fatigue, hoarseness, difficulty with singing voice. And the things that I use to treat muscle tension dysphonia, which would be the full term, is I use different breathing techniques to help relax and open the throat. Sometimes we use manual techniques such as massage or different stretches to the neck and to the shoulders. And also what I always like to say is voice therapy, we love funny noises. So I have a whole arsenal of different sounds that are meant to help balance and reposition the muscles of the larynx so that that way they are not squeezing and pushing on your throat, which can often then lead to that cough response. So voice therapy can help for a number of different areas that trigger cough. And this is where it's helpful if you do have that persistent cough to come in and see us so that we can identify if you have one of these issues that we have listed up on our screen.
Great. Now, one of the things that's important is if there is a voice change and it's been longer than 6 to 8 weeks, we typically recommend that you see an otolaryngologist or really anyone that can look at the vocal cords and understand what's going on. Because a voice change that is persistent, not something from a cold that, lasts a week or two, but, lasts for quite a bit longer than that, should be seen so we can look at the vocal cords and make sure there's nothing bad going on. Now, we've talked a lot of different things, and I hope these are all helpful for you. We have a number of mucus managers, as I'll call them, and they're, some of them will manage cough for you as well. But I'm calling them mucus managers because they really do know how to manage a lot of these problems for us. And obviously, your primary care is a great resource. Our otolaryngology team, to include our laryngologists and speech therapists, our rhinology or nasal surgeons are excellent. Otolaryngologic allergy, as well as other allergy providers out in our UH community. And our nurse practitioners are amazing, and they do such a great job of working on patients like all of you that are having these conditions. Our allergy colleagues and pulmonologists and gastroenterologists are excellent at kind of managing some of the problems, particularly in those cases where you're a little bit more cued in on those things. So don't ignore a chronic cough. But don't panic either. I mean, what I would do is try to do some of the things that we've talked about today. If that helps, keep doing them. Try some additional ones. But if you're not getting full relief, definitely try to contact your primary care or one of us on the list here, and we will try to help you solve your problems. So with that, I'd love to take a couple of questions. I know we have a few minutes left.
Yeah, I think we're going to be doing a rapid fire going down with these questions. And there's a lot of really great ones. I was just peering through a few of them.
Okay.
So I think I'll take the first one if you want, and we can kind of shoot down.
Okay.
So I have one coming from Barbara. Every morning I wake with a small amount of mucus in my throat and can't cough it up or swallow it. After a cup of hot tea, it clears. What causes this? So it isn't uncommon. A big time to have a buildup of mucus is in the morning. And that's simply from while we're sleeping. We do have a little bit of that postnasal drip, and also because we're not breathing and swallowing as much as we would be doing during the day. So you can have a buildup, though. What I recommend for to try to eliminate some of that mucus in the morning is to first, of course, go to our favorite, which is looking at how much water you're consuming during the day. We're trying to get nice thin mucus. Also, another consideration is it's possible that you might be having some nighttime reflux. So that reflux can also then cause, again, a buildup of mucus at night. So thinking about taking something like the Gaviscon that Dr. Howard was recommending at night before you go to bed to protect your throat. And the question about the cup of hot tea, you're probably breaking up all that mucus and swallowing it down into your throat, which is a great strategy, though you can also try my seltzer gargle and let me know how it goes.
Yeah, great ideas. Morning mucus like that definitely has a reflux feel to it. The other thing that can be helpful is sometimes a sinus irrigation at nighttime before you go to bed. So irrigating before you go to bed is a nice thing to add as well. I can't see the questions, Lex. When
you can pull it up on the Q&A, but I'll read the next one. So we have someone who's a smoker taking Chantix to quit. How do I know if my cough is not caused by COPD? Should I see one of you or a pulmonologist? I have not been medically diagnosed with COPD, but I am sure I have it. So does my primary physician. Thank you.
So great question. So a smoker who has had a chronic cough should be evaluated for sure. And both pulmonology as well as otolaryngology would be a great place to start. So either would be fine. Typically, one of the things we're going to want to do, if you haven't already had one, is a chest X-ray to kind of look at the lungs, as well as looking at the larynx. So I think that's a very appropriate thing to do. And as an otolaryngologist, we do that right in the office the same day that you see us. So I think both of us would be great for doing that. COPD patients in particular do tend to have a little bit more mucus and a little bit more sensitivity in regards to cough. But I think if you haven't had a chest X-ray and you haven't had the larynx visualized and had a chronic cough for over 8 weeks, definitely getting it looked at would be a good.
All right. Is it common to have more mucus issues first thing in the morning and or later night? And I believe we just touched on this. So yes, it's common, but something to look at.
Yep. And I just found out that, so let me see. Go ahead if there's any others.
Oh yeah. Let's see. What does it mean if I cannot clear my throat and it takes many tries to clear it? Probably thick mucus or weak vocal folds.
And we saw some people like this just this week where they're trying to clear something in their throat and it's just not clearing. It's not clearing. And it turns out that there's a lesion on their vocal cord. It might be something benign, but it might not. It depends a little bit on what's going on. So the chronic throat clearing typically is just that, and it's you're trying to clear the throat. But obviously, if it's not getting better and you've tried a lot of the things that we've talked about today, getting it looked at is a good idea. That can be any otolaryngologist that can do that right in the office, and that would be where I would probably start. But again, throat clearing, if it's something that you can do the strategies that we talked about today and get relief, it probably is nothing too concerning. Now, I am reading a question here about what is laryngopharyngeal reflux, and we talked a little bit about that. Obviously, medications are an important part of treatment, but as we discussed, diet, behavioral changes as well can be helpful. So avoiding some of the foods that can create reflux. There's a number of reflux diets you can find on the web. Avoiding things like tomatoes, which are healthy and good for you, but tend to trigger more acid. And again, adding that Gaviscon, which I think works because it's a barrier instead of just using something to stop making acid, because you're going to continue making the acid, and the acid, even though it's not quite as concentrated, can still stimulate these cough reflexes.
So along that line, can you take Gaviscon with pantoprazole?
Yes, you can. It's not a bad thing to take. And we take that, typically you're going to take your proton pump inhibitors about 30 minutes before a meal. And depending on what your provider is recommending, we typically take that once or twice a day. Oftentimes for LPR, we take it twice a day, once in the morning and once in the evening. Again, the reason for that is most of these medications have about 12 hours in your system. And we're really trying to reduce their ability to get small micro aspirations of reflux. So we have to take more of it. And it's a lot harder to treat than GERD or the kind of the standard reflux. The nice thing about Gaviscon is it works in a totally different way, and it's really trying to block anything from coming up, because sometimes we have reflux that's not acid, and that's something that people sometimes get a little bit confused by. But we can actually reflux enzymes that we use to digest our food, so that can cause problems.
All right, so quick shout out. We did have a participant who tried the PA and she said that it worked. So there you go, guys. Okay, so for someone who has a medical condition that limits the amount of water they can drink in a day, would increased use of humidifiers and nasal rinse be sufficient to make up for that?
Good question. I mean, water intake that's in your system is probably the most important. But obviously supplementing would be really, really helpful. I don't know, what are your thoughts, Lex?
So I do think it helps with the system. You know, it's a big challenge when you have to modify the amount of water that you're taking in. But we have to think there's several forms of hydration. One, both in the water that you're taking in, but also the water that you're exposing yourself to environmentally. So that person might have to lean a little bit more towards making sure that they do have that humidification system at home, at major areas in their house, and then also at work. And then really, if you have to limit the amount of water, find what that limit is and ensure that you're getting every ounce of that water that you're allowed to get. All right.
Yeah, getting all of that, and then using things like the nasal gel, which adds some of the humidity and it sticks around. Because I mean, unfortunately, if you're doing your normal day, and your mucosa dries out, you're definitely not going to be getting that moisture. So that nasal gel might be a really good thing to try. So
I do have somebody here that I think should possibly come into our clinic. So we're looking at a wife who's had thyroid surgery with damage to the superior laryngeal nerve, has trialed speech therapy, but is looking at other options. So I would say in general, please come see us. We'd love to see you and discuss
that's
other options.
great, absolutely. Someone asked about the Navage nasal system. It's a good system, and I think we might be out of time. It kind of works in a different way, but very similar type of effect. Obviously more expensive though. So.
And sour lozenges, my favorite, are icebreaker sours because they're easy to find and they're sugar-free, so they're not dry and very easy for diets. So I wonder if we're able to type these answers after the talk, because we have quite a few questions.
We see a lot of these. We'll try to work with our organizers to see if we can develop a little after talk page of some interesting things. And we actually have a number of handouts that we give to our patients when we see you to talk about what's going on.
So it looks like we do have another 5 minutes. So how about we see if we can answer some more folks?
Oh, great.
Yeah. So let me see. Do other liquids such as milk and coffee contribute to your daily liquid intake? This is a good one. So yes, they do. And in varying forms, of course. So you have to consider what else is in the liquid. So I am an oddball in the voice community in that I am a coffee lover and a coffee pusher, but I feel like everything in moderation. So I ensure, so when I'm looking at my daily water intake, when I'm drinking things like coffee, as long as it's not something that's agitating any form of reflux for me, I'll take about half of that and count that to my daily water consumption. This, though, is I do still consider that I want to get at least 64 ounces of clear water in during the day. So I'll count that for my bonus water, so the answer is yes, but still I wouldn't drink only milk and only coffee and only juice. You still want to have nice clear water.
Yeah. Here's an interesting question. It says, it sounds like you're considering coughing and throat clearing to be the same thing, which I don't think it is actually. My throat clearing is completely voluntary, and I do it because I feel like I have mucus in my throat, and it's always productive, but not large amounts of mucus. So it's a great question. Lex, what are your thoughts on the difference between a cough and throat clearing?
So I do look at it as almost like a sliding scale. So a throat clear can be a much less aggressive than a cough, and it also is in response to different things. So a cough can be a very volatile response, whereas a throat clear, like you like the questioner asked, is that there's just a little bit of mucus that you want to clear the throat. So a throat clear here and there throughout the day is completely fine, and the vocal folds do very well with tolerating it. When we want to start looking at it as an issue is if it's a consistent thing throughout the day. Like the question asked, is saying that they do have mucus that they need to clear. So my question is, can we look at other ways to clear the mucus aside from using the vocal folds themselves? Because either way, the similarity between a cough and a throat clear is that that closing of the vocal folds. And so if we can bring some of that out of your day, your throat is going to be in a much healthy, happier position.
That's true. And, sometimes I liken it to, an itch. You scratch the itch, and sometimes after you finish, it's actually itchier. The same is true with throat clearing and coughing. Now, I think there is a difference between a non-volitional and a volitional cough. And as you get into the volitional cough, like you try to cough to clear, obviously that and throat clearing, again, it's a gray zone. Obviously, a true cough that is just triggered by one of these cough receptors is uncontrollable and very different. But they are very much stimulated by the same types of things. So very good question.
Sinus rinse bottle. How often do you have to sterilize the sinus rinse bottle, and how is this done safely?
How is what?
Sterilizing your sinus rinse bottle. How often and
yeah,
how do you do?
So first off, one of the important things there is, I typically recommend not using tap water and using distilled water. It's very inexpensive. You can get it at any grocery store. Microwaving an empty bottle once a month is what I've had one of my colleagues recommend. And I think that's a pretty good regimen. They typically will replace their bottle, a couple of times a year. I think that's also reasonable. These are not very expensive. And the sinus packets that are relatively inexpensive as well. There's also formulas that you can create to create your own. When I see patients and I recommend these things, I typically have a sheet that I give out that actually has the formula on it. It's not very hard to make. So it's a very good way to do it.
I eat and drink in my recliner while reclined most often. Could this be causing my sinus drainage to drain down onto my vocal cords, causing my chronic cough? I've had this issue for over a year. So I will say, I'd love to hear Dr. Howard's perspective on this, but just thinking about swallow safety and an effective swallow, the best position to be eating in is upright. And that's simply because if you think about the process of swallowing, there's two major components. Of course, there's the chewing, and then there's the portion where you send it back into the back of your throat, down into your stomach to fill you up. So when you do the sending it back motion, when it goes into the back of your throat, a lot of things occur. So your airway actually has to close off, and essentially your windpipe closes and your food pipe opens, and it's a very intricate dance. So we want to make sure that the timing of that swallow is very appropriate. So a big way that we help that swallow is to be upright while we're eating. If you are leaning back, think for a second, if you're leaning back, you have the possibility of liquid or food particles to then slide in the back of your throat while you're chewing and enter your airway and enter your throat before you're ready for them to go there. So my first recommendation would be actually to trial eating at the table upright for all meals and see if that helps with the cough. Do you have anything to add, Dr. Howard?
One of the things that's tricky and sensation is such a big part of cough, and it's a big part of eating. And, when we think about patients who are eating in a reclined thing, they have mucus dripping down the back of the throat, maybe some inflammation that's going on. They're definitely not going to feel that little bit that's going down, and they're going to aspirate. So again, I totally agree with your thoughts on the safety first kind of thing. Working on trying to, again, sips of water to help kind of clean out some of that mucus, get your sensation improved. Trying to work through those things is also something that we see a lot in our patients who have difficult times with swallowing. It's tricky. I think trying to understand if the patient has actually some real sinusitis would be nice as well. Sometimes that requires us to take a look. But it's definitely a challenging situation. But I think your recommendations as far as the swallowing are very, very much right on.
Looks like we have time for two more questions. One quick one is, what is the best time to take omeprazole?
Yeah, typically I recommend taking that in about 30 minutes before your largest meal of the day, if you're taking it once a day. If you're taking it twice a day, I typically recommend doing it in the morning before breakfast and then in the evening before dinner. Again, spacing it out through the day. The reason that we sometimes will take it twice a day is to give you a longer benefit of action to try to reduce the overall acid level inside of the stomach. And that can be helpful. We typically do twice a day for patients with LPR because it's treated better that way in the studies that we've done with patients with this problem. For GERD, typically once a day is what the GI providers will recommend in most cases. There's one here about a patient with severe sinus problems, postnasal drip, and a paralyzed vocal cord, and they always feel like they got mucus in their throat. This is a patient that needs to come in and see us. There's definitely things that we can look at together and figure out how to help you there. This is right up our alley, and there's a number of things that we can do for you.
And I've seen a couple of questions about the funny noises. Come see me if you have a voice problem, and we can find what funny noises work well for you.
Well, very impressed by the number of questions, and thank you for the nice jobs and thank yous as well. So thank you, Lex. As always, it's a pleasure hanging out with you and talking about mucus. We tend to do this a lot. And thank everyone in the audience for being here today, and hope you have a wonderful evening.
And it looks like we might be coming back in a month or two just to do a Q&A. So kind of keep your eyes peeled for that, so we can just sit down and talk everything mucus.
That sounds great. We love talking about mucus, don't we?
We love it.
All right. Y'all have a great day.
Thank you very much, Dr. Howard and Lex. Thank you very much to the audience. You're all very engaged. Great presentation. Just as a reminder, this is being recorded. In approximately 1 week, you will be receiving an email with a link to this talk to go back and watch it again, if you so choose, and share it with friends and family. Again, thank you for spending your evening with us, and we look forward to seeing you in the future talks. And as Lex mentioned, we'll look to see if we can bring these two back and just do a Q&A section for you. Thank you very much. Have a good night.